It's vibrating.
It would make sense if I was fully employed, but yeah, I mean, why not? I can imagine people who go on for like 14 days. The whole 14 days, urikumba.
Yeah.
But is there a mechanism which they are checking? Because you know there'll always be loopholes with these things, right?
And you know what? All those are great questions. We're going to try to understand a little bit more. And if we were to bring one such, because it'll be a label or alteration, what would that look like? And it's interesting because Women's Month, we were talking about these things, about how women's health in the workplace is such a big talking point. Menopause is high up on that list, but that's a conversation for another day. Doc, we're so excited to have you back in studio as you're going to help us talk and understand a little bit more about endometriosis. So last week you started explaining to us the woman's anatomy around, you know, what's going on within our setup. So firstly, Doc, start by just describing the major organs within our reproductive health as women which may be affected by endometriosis. I remember last week mama kutidzisa kuti kune lining irimo mukati momunhu inozogezewa neropa kupera kumwedzi. I know that sound, I know just saying that sounds so right. And I think that's so sad that we have to feel yucky and
I think it's because of how it's been made out to be. Like, remember the other sister was here. She said at the time it was like a taboo to talk about it even with your parents. So now it's normal. Say, oh, you know, I'm on my period now. Like, oh yeah, okay, so are you okay? You know, it's normal now. But then you could not.
Yeah,
it was a taboo. And you know, today in the morning I had a conversation with a friend. She's like, they had a tuck shop, and when they wanted stuff from the shop, she would take. So her period hadn't come. She started going on late, and then she took cotton wool. And so the father was going through sales, and so she took cotton wool. And I'm like, hey, just even saying cotton,
yeah,
you know, because at least at the time, the father understood, but he made her then talk to the tetes.
Yeah.
So that they would then start telling about the birds and the bees.
That's if you're lucky enough to have a tete stella. I can imagine there are many people who do not have tete stella to then still say, go and talk about the birds and the bees. And this is why we're excited to have you, Doc. Walk us through helping us understand the woman's anatomy and how it connects to endometriosis. Good morning, Doc.
Morning, Falaki. Morning, Mai Juju.
Morning.
No, it's my pleasure to be here. Kuti zvakamira sei paanatomy yechidzimai. Saka anatomy ine yakanyakosha ndio chibereko chacho chatori muchirungu uterus. Saka ndo imba ichagara mwana. Saka zvose zvikuitika imomo zvinoenderana nekukwanisa kuzotambira pamiri zvichikudza mwana. Saka mukati mechibereko chine madziro acho, then mukati macho ndo mune lining. Lining iyo yakangoita kunge nzvimbo yatinodyara mbeu. Saka period inotanga kuita thicken, zvoita kuisa manyowa mumunda wedu kuti muzobate mbeu zvakanaka. And then by mid cycle inenge yasvika pamaximum pacho ndo time ichabva yauya zai rosangana nemale seed. Kana zvasangana zvobva zvazvigara imomo. Asi ngatiti hapana kuitika fertilization. Poshaya mbeu yajakarwa ipapo. Pane zvinotoitika kuovari zvinobva zvaita kuti chibereko chitsamwe kuti hapana kudyarwa mbeu. Chobva chaita kuchema ndo period yavaita se yabuda iyoyo. Saka zvinonge vakadzi vazhinji iprocess inoitika almost every 20 to 30 days. Because the normal range is 21 to 35 days in the menstrual cycle length. Kuverengera kubva musi unotanga period up to the next period. Those are the days in between. Kana madays are less than 21, we start getting worried. Kana akuita more than 35, we start getting worried. Asi line iyoyo pane dzimwe nguva dzekuti inopinda madziro echibereko. Yaakutanga endometriosis manje. Dzimwe nguva inoenda kure kuma-tubes because kunzwisa chibereko chakafanana nemuviri wedu. Tikatarisa chest yedu ine maoko anenge ari matube, and then chest ndo muchibereko macho. Saka dzimwe nguva lining inenge inopfuurira kuenda kuma-tubes yobuda kuma-ovari. Maovari ndo anobuda mbeu yechikadzi. Dzimwe nguva yobva yaenda nemudumbu mese kuma-intestines. Saka inenge yakupota ichita kunge iri mukubleeda ikoko zvakare. So ndo reaction inoramba ichiitika iyoyo. saka reaction painenge ichitika zvinoita kunge parukwara yatoti inflammation ende kupora kwacho kunobva kwaita scarring and that scarring ndinotanga ichirwadza pain yacho inozotanga iri every month but the time unopedzera yacontinuous because paita too much scarring so to some extent inobva zvese zvinonamana yatoti frozen pelvis ndo west extend endometriosis mumadziro manga muchiita also bleeding munopedzera thickening yacho yakasiyana nemafibroids atori mabhora anokura mumadziro echibereko but iyo inenge yangozvimba mese imomo saka maperiods anobva aita even more irregular kana bane too much yatitino iyo endometriosis kumadziro echibero toita adenomyosis ndositara iro yechirungu zvese zvinopedzera zvakuita pamiri paradza kubata my periods aite very painful and aite very heavy so those are usually the common symptoms zvinowanzooneka kuti vanhu vanowanzoita maperiods anorwadza chaizvo pachivanhu yainzi jekogono and vaizviziva muchinyakare kuti vasikana vane jekogono vanonetseka nekubata pamiri aitozwa natito mwana nejeko rakaita serakwene unogona kunetseka nekubata pamiri saka zvagara zvizikanwa pachainge chinyanyoshabatsira nguva indoti vanhu aikasika kuita pamiri vanhu vazhinji vaizodzamara vasvika kuma25 vatoita vana because damage yeendometriosis iri progressive panoramba pachingoita those reactions panamba achidamage matubes even maovari acho anobva mbeu ari kubleeda inside achibva apedza mamwe mazai saka there's progressive damage yekuti by time ateta tazoita makore akawanda especially after the age of 30 effect of fertility inenge yatsisimbei
so this lining that's growing outside the uterus inoramba ichikura here pakasiyana-siyana kana tinoti payakura ipapapa achizoita ronda iroro pozotaka kunamanamana zvobva zvapera yobva yakura futi pamwiri
inoramba ichita inosiyana mumakuriro acho muvanhu vamwe vanongoita yatinongoti mayaro isikambonyanya zvayo koita vamwe vanoita iri so severe inonamanama zvose saka inoramba ichikura
panhu pamwe kana uchinotsvaka
zvingosiyana-siyana chirwere chinonetsa zvokuti wese extended munguva chinoita kune nhengo dziri kure chaizvo chinooneka even pasikatishe pano padumbu dzimwe chakaonekwa malungs dzimwe chakapinda musoro chaimo
sounds dangerous fatal
so inongoenda toite ectopic meaning outside the normal area but ndo the worst case scenarios.
Okay, so I've got a question. As it's growing, what is it like? Does it look like a cyst? Does it look like thick liver? What does it look like? Or kana mkuru makamu operator muno amakabvisa. It's like I had a lipoma when they removed it, looked like a big chunk of fatty looking things, right? What does this look like in the event where you've treated people or you've removed it? What does it look like?
Zvakangoita kunge liver ndo yatikati padhuze zvangoita kunge zvinonena zvokuti kana mukazvigeza zvangoita kunge zvinobuda pamaperiods
like clots. Got you. Mai Juju brings up something very important that she mentions cysts.
True.
How do we connect endometriosis to cysts?
Kune cysts dzinogadzirwa neendometriosis tori pazita rekuti endometrioma kana kuti hemorrhagic cyst. Hemorrhagic meaning mableeda mukati, so pakableeda muovari. Cyst ingori like a balloon ine zvinhu mukati. The common cysts dzine mvura but irori rine ropa mukati, saka zita racho riti hemorrhagic cyst kana endometrioma. Saka because mune lining muovari imomo muri kubleeda, muri kuitawo period imomo muovari imomo. Kana ropa racho rimusima kana ragara rinochinja kuita chocolate, atinoti futi machocolate cyst. Patinoparita totoona metere inobuda chitange chocolate, like a really chocolate.
And I can almost imagine there was that one doctor
who had to call it chocolate
and who had to try it.
Is it also the color or the texture? I want to understand.
It's just the color.
Okay. Okay.
All right. So how do we get to a place, Doc, from where you're saying, okay, this is just because for most women, we our understanding is that those red days must be painful. So how do we get from that stage where it's normal pain and pain that's worrying, that's going to endometriosis?
Okay. Usually severity ndinowanzotaura no inofanira endometriosis. Jeko rinogona kuitika pasina endometriosis. Asi jeko pane rakanyanyosimba teda kususpecta endometriosis. Saka achitora history mukaona kuenda kwachiremba especially sumagaina tinotobvunza flow, toona pattern yeflow, tozobvunza pain. Then you qualify pain yacho kuti pain inodisturba function yako here. Unokwanisa kuenda kubasa unoshanda semazuva ese able to do your usual chores without any disturbance. Kuona zvakutodisturba function takutanga kufunga in terms of endometriosis. And then tikaona ichida mapirits tikufunga kuti endometriosis. And then tiwanzoita severity score toti from 0 to 10, how do you score this pain? 10 being the worst extent and 0 being nothing. And this one vanenge vakutwara mapain ari kuma 7 out of 10. It's likely to know this reaction is more than usual, more than just due to chemicals zvinoita kuti lining in there. And the pain actually after a certain period unotanga before the period. It can start 1 or 2 days before the period. Yakusuggest no, there's no progressive damage repeated. Consider this pain, it is scarring. Saka kana pain itanga before the period it's secondary dysmenorrhea, meaning it had any cause ilipo. So that's how we classify it. But proper diagnosis inozozoitwa kana tana so tatodongorera mukati usually vanotenda anonzi laparoscope, which is really keyhole surgery. Takatarisa necamera toona
chamunopinza chiya
tosikotora kanyama, but the symptoms are usually very good in just giving us a diagnosis.
So is there a way you can test before you reach the laparoscopy stage? Could you let's say how they test pregnancy? You can use a urine sample, or you can use. Is there a way you can test other than that?
Unfortunately, nothing up to now. There's no test other than checking a piece of no lining even taitora kuno kuma muscles pane inwanzoita paguhu endometriosis but every period pane pachizvinga it's common vanenge vambochekwa paguhu. Imwe yacho inoitika even mubladder munobuda weight yekuti vanenge vakuti pamaperiods vanoita weight inorota. Saka but tikangotora kalaini even yemubladder kana ipapa inotonodescribe no ilining mukati mechibereko saka endometriosis.
0719104404. We're talking about a condition that many women are actually having to live with. Statistics suggest that at least 1 in every 10 women is struggling and living with endometriosis. Now imagine living with endometriosis and not even knowing that is what you have. Doc is giving us some insights into understanding not just how our sexual reproductive health works as women, but giving us insights into understanding what exactly it is and how you might be able to identify it. Doc has given us a couple of clues so far in terms of the symptoms. And sometimes they've been progressively worse. It could be a sign that something else is going on. If your cycle is longer than 28 days from the day of your first red day until you have your next one, 35 days, there's a problem. If there are less than 28 days, that's also a problem. 21, that's also a problem. Doc, talk to us about coloring. So we call SES on our show coloring, right? We also hear there might be discomfort related to endometriosis when you are coloring with your person.
Come again, what do you call coloring?
Oh
yeah, all right. Thank you. Sorry.
Bridget might. Now, Bridget, before you answer that, Doc, Bridget last week told us that you have an employee who struggles monthly when it comes to heavy period pain. Dysmenorrhea, that's what it's called.
First time I couldn't understand, but now I'm trying to. I'm trying to understand her.
Yeah.
So I just said, God, please help me so that I can try and understand this girl.
Yeah. Interestingly, we were celebrating before you came in. Zambia becomes the first country in Africa to allow menstrual leave days.
That's nice.
Would you be comfortable and happy to let her go
as an employer?
Yes, I'm a woman. I should understand another one. Okay. We have those issues. You need to deal with that, and I think I could understand that because I'm a woman as well.
Imagine if you had 4 women working for you.
Yeah.
So that means in a month you've got at least
4 to 7
14
days where they are not there.
where they are not there.
Each.
Yeah, and ufana kuita moyo murefu
And
to
each
another
you-
person.
No, because if mine is ranging from 4 to 7 days, hers is 4 to 7 days, it means it's about 7 days. It's people your 7 days, and you pray they don't go on at the same time.
No, but we said 1 in 10, so it's not all of them going. It's only 1 in 10 with
That problem.
This is with endometriosis. But let's say regular women, right? You need about 4 days each, and you got 4 women working for you. So 4 days by 4, that's 1 week plus 2 weeks actually.
What I'll do is like I'll have to accept the heavy ones, like the ones that starts, and then the other ones we can come to work. For me, I come no matter what.
What do you mean?
No, but do you know what the...
I
No,
don't believe this, I guess.
Pane is so strong. Pane Aninga is so strong because now we are running a business. We
Yeah.
can't have 4 days each on the business as well. We have to balance it out.
It would then mean you need
Because
to
the company-
employ men and
Yeah.
women.
Yeah, men. We end up employing men.
But also, how do you measure that her period
Is more intense
I
than the
talk to
other.
her. She can tell me, the ones that are intense are on these first 2 days, and the other first 2 days are light.
I think it's
Yeah.
easier now to say it because there's no holiday involved. When now a holiday is involved, every day is intense for me.
Yeah, this is very interesting.
Abuse.
And I'm laughing how this has actually very interesting. And this is not even about you. This is a general feeling that's out there. Even yeah, it's a maternity leave. It then becomes a gender issue. Who then becomes the better employee? Men
Or
or women?
Yeah, some of the companies they don't employ women because of the maternity leaves and stuff like that. They always like say, especially Indians, they don't like employing women because of that.
I even saw at somewhere where I worked, their contract you're not allowed to go on maternity leave on the first year of your contract. Like
Still in 2025.
I think that should even public service. First day you go, but it's not paid.
But the law has changed now.
No, you go, but first year that's your contract. You don't get paid.
I'm hearing you, but I'm saying the Labor Act has amended those things to make sure, because it's not your fault that you. It's also national duty. But this is very interesting. I'm really loving having this discussion because normally we have this on Workers on Wednesday. So you can imagine if you're having all labor experts, they all seem to know the labor law, so they exist, that they agree. But when you take it back to us, the regular people,
we don't know.
no, and it's not even judgment of not knowing. It is the realities of where we feel down. But if you're going to have 5 women at my workplace, problem. Now, do I really want to know who's heavier, who's lighter?
Who's not?
Do I need to have a chart on the wall to say, Ningi mark
Tick
your
your
days?
days.
Yeah, but if you mark your days, also I'm not gonna pay sana food.
And also, Doc, now that you're here, we were asking about coloring and endometriosis, but there's also this thing that when women are, if I'm on and I spend time with Bridget and Mai Juju, is that true or is that?
No, not scientifically. No, we don't know about that scientifically.
Okay.
So we
Because
don't.
I saw
But
my
it
maid
kind
at
of
home.
it happened to me in Nene. I've never had a period cramp, but my best friend and also that one worker of mine, when they are on, especially my best friend, I would feel the same thing that she's feeling when I'm around her. Yes, I felt that.
Let's put this out to the listener, right? Auntie, sister, I learned the other day, science is about observation and study, right? If you're listening in as a woman, have you experienced when you are going through your red days, right? And then you be in other women's spaces and then they end up having red days because one of you was on their red days, or the other way around. Waka hakira because someone else was on their red days. Is this an experience or is this something that we just say but there is no such thing? 0719 100 404. Doc, you were talking to us about coloring and endometriosis. Talk to us about that experience. We are understanding that the lining the tissue is now growing outside the uterus. Magatino and you said it's called ectopic something, right?
Yeah.
So why does that result in pain when coloring?
Because now the reaction, the inflammation, the fibrosis is now around the uterus. during the coloring activity, there's lots of movement.
I just say coloring.
Okay.
It works.
So we do ask about pain during coloring. It's an indicator of severity of endometriosis. So if it's so bad, it's like that, some end up failing to color.
They don't enjoy it.
I've got a question. You said whatever endometriosis things resemble liver, like blood clots. These are not like open wounds, are they? They're not, right?
Yes.
So if they're not like open wounds, then why would they be painful? Probably they'll cause discomfort.
They are causing a reaction, continuous reaction, call it inflammation.
Okay.
Some injury process happening in the body. Body reacts. When the body reacts to any injury, there are some chemicals which come around which cause the pain reaction.
Okay.
Yeah. So
And it's also, I'm also guessing, Doc, that's also another way of the body letting you know that there's something else that's happened by sending that pain.
And that healing process results in scarring. Scarring can now attach different things, even go around the nerves and even cause more chronic pain.
How serious is endometriosis, Doc, in your experience as somebody who specializes in fertility? We know that it may lead to infertility, right? How common is endometriosis, Mumsba?
Okay, it's just the same in the national statistics, 10 to 15%, meaning like out of 100, we're looking at 10 women. So very differs. Most obviously, people are able to function, but they don't get the severe cases. So many things happen to women with severe cases. The pain, what has Shanda. Vamwe vacho vanopedzera even vatoma addicts.
Painkillers.
Opioids. Opioids, because this pain kuramba iripo, and usually people don't understand them because they are always complaining of pain. So they sort of get segregated in society. They can't do a lot. So in a very devastating effects with a small number of women, which is why it's important to have it diagnosed early and find treatment, obviously, and sometimes products have very good results. You can be controlled right from the onset to prevent progressive damage. So, but the biggest issue is that information is not out there. So somebody can suffer for 10, 15 years without even knowing about endometriosis.
All right, so as we're talking about endometriosis, we're testing your knowledge now from what Doc has said and from what you thought you knew. All you have to do is answer true or false. If you're going to send a message, you're going to have to send all your answers in one message so that you don't do true, and then we're going to try to find all your messages. Just send them in one message, all right? So here's the first question. Endometriosis is just bad period pain. Is that true or is that false?
You're also doing?
Yeah, you can. Pregnancy cures endometriosis. Is that true or is that false?
Shouldn't there be a third answer? Like a maybe and explain.
You can maybe it. Yeah. And then endometriosis means you can never have children. True or false? We'll be hearing from the doc in a minute whether this is, and we're also checking with you. Do you agree? If you are in a space with another woman who's having a red days, you might also end up being on your period because another woman is on a period. 0719 100 404. So doc, talk to us. How do we manage these symptoms?
Okay, so for endometriosis, firstly, the simple symptoms just the painkillers, so that the pain is bearable and the affected people are able to function. And when my periods are, they go on their daily activities since we don't give them any duty leave. But the eventual pain is really treatment is to suppress the ovarian activity because the tissue grows in response to ovarian hormones, especially one which is called estrogen. So if we suppress ovarian activity, that helps a lot. So we do give people hormonal treatment, and the cheapest and simplest is just to combine oral contraceptive pills because suppress akushanda kwema ovaries. Obviously there's lots of resistance to its use, especially in our culture. People think it's harmful, but it does give very good control. Then we do have more specific drugs, very effective, people will give them, will say, no, I'll be feeling fine for the first time, I will not feel any pain. There's a drug which we give, which calls Dynogest, which is taken every day, which is very, very good. Again, it's similar to certain hormones, but it suppresses estrogen production. And the endometriosis actually gets less, and the direction way better. And then when it's really severe, we can do what we call medical castration, which is really stopping your ovaries from functioning, but temporarily. We give a very powerful injection which blocks the hormones in the brain, which stimulates the ovaries to function. So there's an injection which calls Soladex, which when you give that woman it feels like menopause, or it creates a pseudo menopause. For a certain period, we can have a monthly injection, we can have one in about 3 months. So that's really when you really want to be very aggressive and suppress my symptoms of endometriosis for a good period. And when you give that injection, like the 3 months one, the woman is not going to have a period for after about 5-6 months, and the protection will last for about a year. So these are things we can do trying to buy time. When there's been lots of reaction, things are operation. The best is laparoscopy, to keyhole surgery. Toenda cheka nekupisa endometriosis yacho zvinopa lots of relief. Vamwe vanenge vaita mazisista neropa maovari. Masisita aneropa maovari tinoabvisa kana munhu especially kana asina fertile desire. Kana ane fertile desire anogona kuzoreduce number yemazai futi, saka it's very difficult. So kana ane fertile desire, we better just draining off the blood there, though there's still that recurrence, which is to grow again after some time. So those are like the main modalities of treatment. It's just suppressing ovarian function. When we are right in their 40s, even easier. Carry to be some ovaries. So this day and age, we try and preserve ovaries because of all treatments. We don't have to suppress ovarian function. Don't go in my estrogen. So chinofana kuti kuti endometriosis hairapike zvokuti yapera asi inongocontroleka chete. Inozoita final control panosvika menopause because maovaries amira kushanda. So but in between up to the age, and the average of menopause is about 50 years, and it starts from 5 to about 55. So it goes really a long way off for many people who will be experiencing endometriosis.
We also hear that there are some women who have no symptoms at all, though.
Definitely, yes, you're very right.
What do we do about that?
Of course, if fertility is reduced, it's only up to about 40% of women with infertility have got endometriosis. So
that's pretty high, though.
Yeah,
40. That's about 2 out of every 5 women.
Yeah, so it's always important to look, especially when these other symptoms of painful periods, then you have to look for evidence of endometriosis if which has been affected and so on. So yeah, it's very important to look for it. If it's early presentation, sometimes you're able to reverse the effects.
So I have a question. Is there a manner in which we can test that's like regular checks, like what they do like for breast cancer? I can just come and say, I want you to check me if I've got endometriosis or not. Because when you were elaborating earlier, then I got pain and dance before, I felt like, okay, that could have been very uncomfortable, even though it was not consistent. Is there a manner in which we can check? Like now, I can come and say, I want to check if I have it or not.
No, it's really just my impression when checking the history. I can suspect. In fact, even on examination, we have a very good suspicion, but obviously there are other conditions which can cause similar pains. So that's the point. I think the diagnostic modality is not easily accessible to many women. I know, for instance, even only this Saturday I was doing an outreach in Mwewa, seeing women, and I could pick signs of endometriosis. But even when there's no definite mechanism of trying to say, let's go and diagnose you positively, because we have to come to our, but we just then treat blindly. We just say, you likely be endometriosis, so I'm going to give you this treatment, and you tell us in 3 months whether you're feeling better or not.
Okay, I also have a question. With those people where they don't even go to the periods when they're breastfeeding, do we have any chances to have that?
So whenever ovulation is not happening, endometriosis does not grow.
Oh.
So maybe to even answer the question you asked, that's how pregnancy now protects against endometriosis. During the pregnancy and then during breastfeeding, the ovaries are not functioning. So the symptoms become better and the progression in yeah, so then the ovaries are now functioning. That's when it starts growing again.
Okay, so we've also understood, Doc, that whilst we don't know what causes it, there are things that we suspect hormones, and so I wanted to know what are, without knowing what causes it, then how do we determine what the risk factors are and what are they?
Okay. So the risk factors, I think it's just your genetics. Just being born with it. Really. There's no causative or associated factors. No, there are things we can say, no, if you smoke, you do this, but this is just something which are
a natural disaster.
Yeah.
And this is not an STI.
It just speaks randomly. But what it tends to run in families. Yeah, so you find if you have it, then you have to check whether your first degree relatives, which is your mother and your siblings, do they have it also. So it affects the families.
So things like weight?
Not really, but weight now might make it worse because when there's excessive weight, there's conversion of fat to estrogen. Estrogen stimulates endometriosis. Yeah, but not like weight causes it. The endometriosis has to be there first.
Okay.
Yeah.
And
What
not
about fat again?
Huh?
You said fat changes to what?
It is
estrogen.
Raymond to starch, which is stored under the skin. That's another level.
Yeah, there's conversion of fat to estrogen in the body.
Okay.
So you've got the high chance of that. Now that estrogen will stimulate the endometriosis, and then it flares up more.
And then also not having children at all, because you said as long as your ovaries are functioning, then there is likelihood of endometriosis.
Yeah.
So if you have not had a child yet, does that increase your risk of endometriosis?
If you are not have children, like your ovaries have never had any suppression in their function, so the endometriosis is really just progressive.
Yeah. Yeah.
That's when you say that also like it wasn't common because people would get pregnant at early stages. So when you get pregnant at late stages, now you're giving it the room to keep on growing every time.
Okay. I'm worried because just now, Doc, you said you're doing outreach Maruzeva. And I'm worried what endometriosis might look like for women in our rural areas.
So they describe the Jaguar very well. Yeah, and already they know this Jaguar is a problem. Yeah, and then examining really feel they have a lot of pain. But the biggest issue is that they don't have access to appropriate treatments. Yeah, even then, we do write some prescriptions, but probability of that medication ever being bought is close to zero, unless you actually go with the medication yourself.
Kudara, but okay, there's another version also. Kudara jeko vanhu vairapa nechibhoyi nechivanhu. What do you say about that? Because when mwana akatotsikana kuti ane jeko, vaitonotorisota ende richitoita sei richitopera. I don't know what it was saying, but it was being done pachivanhu when on early stages when they could notice kuti mwana ane jeko or aroorwa and they realized kuti ane jeko, they would go somewhere kwechivanhu and they would fix it and zvichitopera tozonzwa kuti ane nhumbu jeko riya rakapera.
Yeah, yes, definitely there have been people who treat this traditional by very secretive with their remedies.
Just like pharmacies, though. Pharmacies are also very secretive.
Because they know you all start your own factory. You have to make your own supplies.
So do get women say, no, I bought this and this. But if you ask you what a video was that remedy, they can't give you more information. They don't even know themselves. And you say, no, ask the person who gave you to tell us. They're afraid that we may start selling their product. So no one has really explored. We would love to explore these remedies, but I think they are also suspicious. They think they start making money from there.
Apa vashoma vaimbenge vakawanda vakafa nemaremedi avo I imagine.
So I think one of the things that I'm learning, Bridget, Mai Juju, is that red days do not necessarily have to be agonizing. In fact, the more they are agonizing, the more you should be asking questions. What is going on?
Definitely.
Wow. That, for me, that's an interesting light bulb moment. I don't know if you're listening in, if you're also having the same light bulb moment that, our red days actually should not be agonizing. They should be more comfortable. And you are dysfunctional, you are unwell, unhappy, uncomfortable. There is cause for concern.
I've got a question. So what happens, like, have you seen, I don't know if you guys experience it, like on your own days, I don't sleep well. Why? Because I'm afraid of waking up in a pool of blood, right? Oh. So I think when you're awake and you're attentive, you can listen. Sometimes you can hear your flow. Mm-hmm. It can be in trickles. Probably you can't hear because probably drops.
That was like direct translation from Shona.
You can feel, not hear.
Yeah.
Yeah. Okay. You can feel. Sorry. You can hear. Okay. You can feel. But what
I understood you.
Right. You can feel your flow. But okay. Obviously, when it smells like nothing's coming up, also good at that. Right. That like huge whatever. And it seems whenever that happens, when I'm in my sleep, next thing I'm awake. Mm-hmm. What happens, doctor? This huge, tap that's been opened.
Sounds like you've got mental trauma.
You know why? So in trying contraceptive, I once tried a loop. The worst I've ever tried. My days are normally 3 or 4. They went to 7. 7 of those were heavy. I'm talking I would wear a cup plus a pad. And I can't even sit comfortably. Before I stand. And like you're saying about people getting hooked on painkillers, when they inserted, they said to me, if you take Brufen, it reduces it or whatever.
Yeah, it does to some people.
But how then do I not get hooked? Because every other, every 21 days, when I'm going through my 7 days, I'm popping up those pills so that I reduce. How do you then not get addicted, right? So they then said I would talk to this woman. So what happens? No. It will eventually end, Chichi, because it will be trying to get rid of that thing because it's like a foreign object, blah, 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 blah. Until when I got it removed.
So great questions about contraceptives and endometriosis, because you explained that as long as we are disrupting the function of the ovaries, you're okay, and that's what birth control does, right? How is there any connection with it making endometriosis worse, even though scientifically you can't explain that it doesn't?
No, so we actually have contraceptive protective endometriosis, particularly the combined pill. There's a type of lupus hormone which has got a progesterone in it that actually makes the endometriosis symptoms better, especially the one in the uterine, the adenomyosis. I assume the one you got was the copper T. Yes, it does make the periods longer, and it can also cause a bit of cramping pains, which is not supposed to last. But obviously, people's experience differ. So some people it doesn't work at all, like what happened for you. But if you got the Mirena, it usually works for many men, reducing the menstrual loss. But for some, again, it doesn't work. But just for a few, when you get undesirable effects. The combined pill is very good in controlling endometriosis pain. Yeah, but again, it's got other side effects. It can increase your premenstrual syndrome. This is just this general feeling unwell towards the period. Combined pill can increase those symptoms, the headaches, bloatedness, and so forth. So some people won't like it because of that. And that's why when you give to young girls, they can't even tolerate it. Because sometimes we try to treat the school-going age girls.
All right, so some great questions that have come through. And I was also checking with you how much you now know about endometriosis. We were having a little bit of fun with our true or false questions. And I asked you, is it true or false that endometriosis is just bad period pain? Pregnancy cures endometriosis. True or false? Only older women get endometriosis. True or false? Is it true or false that endometriosis means you can never have children? I'm going to be checking with you because I don't mind you. You were also writing your answers. I'll check with you. Doc, a couple of questions that have come through. You were talking about, Anzi, are there any foods that can help reduce endometriosis symptoms?
I think people have to try that, because there are certain chemicals which are protective, certain chemicals interact with hormones. So there's always so many chemicals which the herbalists would know better. We are just we are scientifically trained, so we only the things which are patented as what we tend to prescribe. But I think where they've got properly trained herbalists, there are countries where they've got herbalists who actually go to formal school. They actually know what works for this and what will release this pain and so on.
Okay. And so I went to the clinic and they told me to just take painkillers. What do I do if the doctor doesn't take my pain serious? And this is very common actually for most cases. Shapora, mefenamic acid. No. What do you do?
Possibly the doctor doesn't have the diagnostic tools. Maybe they don't even have a scan. They can't make a positive diagnosis. So they just treated a simple period pain, which obviously is just painkillers. But if the pain is that bad, she needs to be escalated upwards to come to a gynecologist. Public sector or gynecologist in every province now, which is actually a good positive thing, so that they get a positive diagnosis and they have a long-term plan. Because the long-term plan actually now says if you are a certain age, we know you are not yet interested in having children, this is the combo we are going to give you. When the childbearing age is into such a desire, this is what we are going to do. If post-childbearing age, again, there's now a different treatment for you.
This one is an interesting one, and I would like to hear the ladies also responding to this. I feel embarrassed to talk about my pain with my boyfriend. How do I explain endometriosis to my partner without sounding like
I think the boyfriend actually doesn't know. He's not aware, which is the reason why because imagine I'm explaining to him period pain that he doesn't know, he's never been educated about. So like same thing about I've got pain on the painkiller. I ask him to see the intensity or even understanding the whole anatomy of how it works. Saga boyfriend not to educate kwa first. Could period so and at times my effects are die in certain women. Hence in the feel so. Then where China no Google out to my link in my picture so they understand.
I not to Google she needs to explain to him because that's what I go through like on these days, so you should understand me.
On that point, women experience lots of pain due to endometriosis, especially now when it's made worse by coloring. One of developed by a condition and a genetic pain penetration disorder. Because vital bad experience like coloring, their mind now apprehensive,
they're anticipating the pain.
So coloring body prepare anticipate. But can I muscles sunga or tense. So it means even an attempt is going to be worse. So that's what it even more injury. So it becomes a vicious cycle. Coloring becomes more and more uncomfortable, and because I'm part of that reflex to my muscle sunga and the vaginismus. To pay the eventually the husband and time eating a brick wall, the brick wall sensation, because we are even I'm the guy that was side. So to not destroy my relationship, because we are as questions. It's important. Can I agenda for your even this one in the very way? So now so long as I'm with us, but those repeat and this what will happen, how do you help each other? The coloring actually foundation and
It's sounding very more complex and serious than what I thought it was before we were having this conversation.
True.
And this is only endometriosis. Fibroids. Wow. Doc, thank you so much for coming through and shedding us light. So before we go, Mai Juju, let's go through our true or false.
Okay.
You were answering these questions. Endometriosis is just as bad as period pain. Is that true or false?
False.
Well done. Pregnancy cures endometriosis. True or false?
I wrote maybe, because remember we said when pregnancy comes early, it can cure, but if it comes much later, you might not be able to have babies. So
A cure controls.
Controls.
Exactly. That's what I wanted to correct
So,
you.
yeah.
It doesn't cure,
but
but
that's a cure.
it reduces.
Okay, it's like a
Yeah.
fall, like
Yeah.
fall.
But actually, from a Chirungu point of view, we understood you.
Okay,
actually.
well,
That's
thank you.
about
Well,
we
thank
see
you.
that actually. Is it true or false that older women get endometriosis?
Repeat what?
Is it true or false that only older women get endometriosis?
That's false.
It's false, okay. True or false, endometriosis means you can never have children.
True. Actually, it's
False.
It is
But never
false.
go.
Well done. Well done.
Fitty.
So listen, whilst you may be experiencing pain, and now that you know the reality of endometriosis, the truth is it can be managed. There is hope, there is light at the end of the tunnel.
Amen.
My biggest takeaway from this is we do not have to be in pain, excruciating pain in our red days. It is not normal. I've also learned that we must learn to listen to our bodies.
We should pay attention, actually.
Pay attention to our bodies.
And also, like, if we experience it, let's educate our children. Let's go through them at an early stage so that it doesn't go like
You don't nurture it
Yeah.
until it's too
And
late.
educate the boy as well.
to understand it.
Yes.
But you know, when I look at my Juju, I
think
can
it's-
this one even understand?
Yeah. So we got to go to the news. Sister Skipper, we're back next week. Doc, how do we get a hold of you?
0772 260 739.
Mai Juju, how do we get a hold of you?
Oh, 0772 210 290, and I'm also on Facebook as Mai Juju.
Mai too, how do we get a hold of you? Quickly, we've got to go to the news.
0771 326 896.
With that, it's 12 o'clock. It's time for the news.